Thank you very much, Adrian, and the organizers for inviting me back to Basel. I'm not a clinician, I'm a fly doctor. I work with Drosophila melanogaster, for those who remember from their basic training. But I'm not going to talk about that, but I'm going to talk about the second part of this title, your role, our role in collecting and providing health-relevant data that we now 24/7 record on our smartphones. Now, I want to start with an analogy. I think I don't need to ask you, all of you have a bank account, right? And the entire economy basically works because you and I, and we all, invest our money differently and we spend it on different things. It's not your employer who says which car you can buy and what you should do with your money. It's you have the control over your money. And I'm going to argue that if we want to change healthcare and medical research, clinical research, we also have to turn the control over the personal health data over to the individual. Now you say, this is very complicated, I'm completely overwhelmed already with what I have to do now, and I tell you, I'm overwhelmed with the thought that in 2 years from now when I retire, I should decide what I should do with my dritte Säule, my pension plan. I have no idea, really. And so what I do, I go to the Vermögenszentrum or a financial service institution, pay top dollars for a financial plan, what I should do after retirement. And the financial service industry is a big industry, but think about the personal data service industry that will develop when you want to get advice what you should do with your genome, your blood glucose levels, and your microbiome. There's interesting things that you can do with that, but we're overwhelmed. So we ask for services, which are new opportunities for startups, for ETH, for Google, etc. And that is going to be the topic of my talk, basically. Because after all, if you talk about personal data and clinical data, it's all personal data. And the more we heard a lot about aggregation and data interoperability, the more we can aggregate data, the better it is. But the aggregation point is the individual, where, what he eats, what the MRI says, what the genome says, what the infection, the blood report says, all this has to be integrated on the individual. So the individual plays a very important role. And the complexity of this problem, how we react different to medication, to foods, etc., is so complex that we need millions of data sets. And just the records that are in the hospitals in these data silos are simply not enough. And so we have to find an additional way to break out of these data silos. And you heard a lot about SPHN this morning, about the challenges that we have. I show you another slide now that shows the different stakeholders in the Swiss healthcare system that you have to convince that we put all the data into one pot. This is taken from Urs Stromer, who used to be the president of eHealth. And I think it's quite impressive. We have an excellent healthcare system, but in order to transform the data that are in these different silos into interoperable, researchable databases, that is a challenge. This is exactly what SPHN is trying to do, and Katrin Kramery has told you about the challenges that we have. I think we have to go this way. Don't misunderstand me. I think it is very important. But it is also very important that we take an additional route. Because at the same time, while we're trying to set up a data structure for Switzerland medical data, this is what's happening outside, right? Google is connecting to health reservoirs. 23andMe sells genome data, including mine and that of my family, for $300 million to Glaxo. That's the business model, our personal data. We heard also from Carsten this morning, Roche paid $1.9 billion for Flatiron, for 1 million hospital records. That's the situation that we are faced against. On the other hand, we know that we all are very interested in our health data. And since genome costs have come down so dramatically, private companies, including 23andMe and Ancestry, offer direct-to-consumer genetic testing simply to provide information where you're coming from, where your ancestors are coming from. There are 30 million people in the world who have signed up for this and given their genome data away just to find out where they're coming from. Now we all wear Apple Watches or smartphones and we collect data 24/7. But this data are collected by different companies and are monetized. And if we're talking about AI solutions, some say that the train has already left the station because Google and China have much more data that they can train their algorithms that we have no chance to even catch up, and that the University Hospital in Basel has to pay the bill for their AI diagnostic services to Google in the future. So is there a third way for Europe and Switzerland? I recommend you these two books. This is the American model, the surveillance capitalist model, which we have gotten used to since we have smartphones. And then what everyone thinks is the terrible model of China, where they basically just say, we observe you, we collect all the data for you. But if you look at this really, at least the Chinese are honest. They tell it to you that they are collecting your data and they don't give you a train ticket when you pass on a red light. Facebook, Google, and Microsoft collect exactly the same data behind your back, but they don't tell you what they do with it. They just want at the moment to sell you more stuff, right? Targeted advertisement is their business model. So I'm not sure which of these models is actually better. And the question is there a third model? And I'm arguing, yes, there is a third, specifically European model, where the citizen, the patient is in charge. And this is because personal data have three unique qualities. First of all, they can be copied. My doctor has to keep a record of my data for 20 years, but I can request a copy of that. And with GDPR, I now also have a right to a copy of all the other data, because in GDPR, it says the Article 15 of data portability gives me the right to get a copy of my Facebook data, of all my Cumulus data, etc. Data is an asset that is equally distributed amongst individuals. We're all billionaires in genome data, whether we live in Switzerland or we live in Tanzania. And we collect the same number of steps. And most importantly, as I said at the beginning, individuals are the maximal aggregators of their data. Google and Microsoft may know a lot about me, maybe more than my doctor does, but they never will know as much as I could know if I get my Google data combined with my genome data, my medical data, and my Cumulus data. That's only what I can do. And that gives us individuals a real power. And so the European approach really is to give the individuals the right and empower the individuals to collect their data and define a new governance structure where they actually control their data in a way similar as you control your data in your bank account. And so our proposal for this governance structure is a democratic, non-profit, cooperative structure. And this fits well to the personal data management because, first of all, data can be copied, so you can generate a parallel data ecosystem with these copies under the control of the individual. The equal distribution of personal data fits well with the democratic one-member, one-vote principle of cooperatives, a very old form of corporations. And finally, because we have the most aggregation power, we could actually provide much more insight by making our data accessible. And so I'll briefly show you the concept of this data cooperative, which we founded 4 years ago, Midata. It's presently only in Switzerland, but we want to start similar cooperatives in other countries as well. The basic governance principles of the cooperative are that it's a not-for-profit, citizen-owned cooperative. You are, like in your bank account, fully in control of who accesses your data. You can give it out to basic research for SPHN, for a second opinion for a doctor, or to share some fitness data with your friends. In our Articles of Association, it says there are no financial incentives for data sharing. We do not want people to sell their data to the highest bidder. We found out what this does when you do blood donations. In the United States, you get paid. Only homeless people who need the money go and donate blood. If you get paid for your fitness data, you will put your Fitbit on your dog to increase the steps. Finally, the data are stored on what we've heard this morning in these data ontologies, and we use FHIR as the API to import the data. And we have a tested, cloud-based, located in Switzerland, IT platform in which every data set is individually encrypted. And you're the only one who has the key and can share it with other research or, as I said, second opinion. So these are our partners. We are supported by SPHN and PHRT and also SDSC. It's a collaboration between ETH Zurich, Computer Science, and the Berner Fachhochschule, Medical Informatics. Our partners are at the Inselspital and the University Hospital, hopefully also soon at the University Hospital in Basel. But we have international collaborators with whom we are wanting to set up similar data cooperatives in Europe. So the principle is very simple. It's a platform. It's like a bank, which consists of a governance structure. That's the cooperative. In the statutes, there is also an ethics committee that actually approves all the third-party offerings, these data services that I mentioned at the beginning. That in the general terms, it does not say that the data can be sold to the next partner. The data stay with you. You get the services, you pay for the services. And it is the blue part is the IT infrastructure that has been developed and is run and controlled by the MeetData cooperative. But this now provides a new platform for data services, whether it is ETH startups who want to make sense from genome data and blood data or nutrition data, or whether it is a Google Plus health service for which you pay, like you pay for Apple Music or so. But the data stay with you. So it offers an entirely new data ecosystem, but you decide whether you want to take part in this or not. So we have several smaller and larger projects that are running or that have been concluded. This is a project from PHRT where we incorporate now clinical data from the University Hospital in MS patients and combine them with a dedicated smartphone or tablet app that we have for patients to report personal data on their cognitive and motor functions. And we have different working groups in this project. So here now again, data aggregation from clinical data to weather data to genome data will come together on the platform under the control of the patient. This is the largest project that we have launched 2 years ago, AliScience, which is an allergy project where you basically just download this app called AliScience. You can download it right now from the App Store, Android or iOS. By downloading the app, you're basically opening your account in the MeetData platform. You're not a member of the cooperative, that you apply separately, but you have an account now and you agree to the terms and conditions of MeetData. And secondly, by using this app, you also agree that the data will be sent in anonymous form to the University Hospital, Peter Schmidt-Grendelmeyer, who is going to analyze the data to make a Swiss map of allergy symptoms and correlate it with the pollen data that we get from Swiss Meteo. And more than 10,000 people have signed up, have downloaded this app and have contributed data. And now, as we heard in the news already, pollen are already flying, so you can start making use of this app and contribute with your data to a science project. So the next big project that we are launching is a project where citizens, actually healthy citizens, say, I want to contribute my health data to a cause of health cohort to find out what is the cause of health, not the cause of disease, which we know in some cases quite well, but we don't know why we're individually healthy. And nowadays, we collect so much data daily on our smartphones that we can make these data available in such a cause of health cohort. And the thing about this cause of health cohort is that we want to have it launched actually by us, by you, scientists, medical doctors who say we see the need for our personal data being used in research, and we say, yes, we are going to do that. I'm going to pay for my genome analysis, and I donate it to this basic research cohort thing. And I want to expand this cause of health cohort not only to Switzerland, but also to Austria and Germany. That's what we're talking about with our partners. And the first launch will actually be, I invite you to this conference. This is next Monday. It's in the Technopark in Zurich, the first Cause of Health Impact conference, where we're going to launch the idea of this digital health cohort, where all of you are invited to sign up and contribute and sign up for participating in this cohort. It has not been launched yet, but it will be launched very soon. We'll start actually in collaboration with my colleague Marcel Salaté, on collecting blood sugar data on Monday. Everyone will obtain a blood sugar monitor. You can, if you want, set that, shoot it in your arm, and then measure your blood glucose levels during the day to see how powerful your personal data is for your own nutrition. You will find out how you react to orange juice or a low or high carb buffet, and that these data are very important. They're very heterogeneous, so we need lots of data. So in summary, I think we have to, in addition to what we're doing in clinical research, we have to turn this around to give the individual the control over their data and make them active contributors with their smartphones for patient-reported outcomes, for actually cause of health cohorts, etc. And I can highly recommend this latest book of Eric Topol on deep medicine, how it will transform medicine, but it will mostly transform medicine not only because AI and artificial intelligence will play an important role, mostly because patients and citizens will take a much more active role in this new medicine. And that's we need a new data governance model, and our non-profit cooperative model is sort of the alternative to the winner-takes-it-all American Google, Facebook model. So I hope that I see many of you on Monday next week, or at least to sign up for the Cause of Health cohort, causeofhealth.ch, and there you can sign up. Thank you very much.